Welcome, I'm Dr. Brian Abelson. The topic for today is bunions. This is a topic I am very familiar with. I treat it almost every day in clinical practice. Now, there's some real key things that I want you to understand. It's just because you have a bunion doesn't mean that you're eventually going to require surgery. About 10 to 25% of the people in our society have bunions. And yes, it's that nasty thing that just hurts so bad that you can barely walk, your shoes don't feel good, and you think that, this thing is never going to go away. But there's actually things you can do. I've written extensively on it, and I'm going to give some links here to both the blog that I wrote on it, but also specific exercises, examples of treatment in terms of videos, and things that you can actually do in terms of lifestyle changes. So let's get started. Okay, so let's first talk about causes. A lot of people think there's a causal relationship between shoes and bunions. Now, if we actually look at societies where they don't wear their shoes, they still have the same amount of bunions as our society where we wear shoes all the time. That doesn't mean that shoes aren't a problem. Because if we look at high heels, narrow shoes, cowboy boots, ski boots, a number of different things that actually cause compression on the foot, they will accelerate the bunion process. Also, people that have flat feet or people whose feet actually go out to the side and basically externally rotate. All of these problems will accelerate the bunion process. I just want to mention a few things about biomechanics and anatomy. Why this is even important so you get an understanding of why treatment and exercise can actually help a bunion. There's two muscles, one that goes from the big toe across the top of the other toes and then comes down at an angle like a number 7. Now, that toe when it gets short and contracted, that muscle when it gets short and contracted, actually pulls the big toe towards the second toe. Now, there's a balance between that adductor hallucis and the one on the outside, which is the abductor hallucis. And there's a fine balance there that keeps the big toe in a neutral position. When that adductor gets really tight and contracted, it basically just bends over. So if we can actually take restrictions out of that muscle and strengthen the outside muscle, the abductor hallucis, it'll move back more towards a neutral position. Now, this doesn't happen overnight, and it takes exercise, and if it's really bad, we also need to get in there and break up restrictions with the foot. But there are good reasons why therapy and exercise can work so well. Rather than me going on a long dissertation about diagnosis and treatment, I'm actually going to provide you links to videos in the video description below so you can actually see some of the diagnostic processes we use in evaluating a bunion. We have to evaluate both soft tissue and osseous structures. Now, when it comes to treatment, same thing. We have to address not just the joint itself, but all the soft tissue structures that surround the area. So again, I'm going to give you links to specific videos that we would actually use in treating a bunion. So take a look at that. And if you have any quick questions on that, don't hesitate to drop me a note. Now, there's some general recommendations, things that I want to mention that I find that work really well for patients and help to reduce the overall stress. The first one is footwear. I don't care if you're getting treatment and exercising all the time. If you're not wearing the right shoes, you're going to exacerbate the problem. Narrow toes are going to cause a problem. A lot of women's dress shoes, you just can't get around it. They are going to cause this area to flare right up, and there's a good reason why women have 10 times the rates of bunions as compared to men, and it's all because a lot of it's because of shoes. So the wider shoes, even though they may not look quite as nice, they will help to reduce the inflammatory responses. Okay, when it comes to toe spacers, the soft jelly toe spacers that you can actually get on Amazon, ones I saw were kind of a blue color. They fit into a wide variety of shoes. You need to wear these in your shoes all the time to bring your toe back to that neutral position. They really do work. They will not correct your bunions, but they will help to move things in the right direction. Taping is another thing, and I'm actually going to include a video link in the description below to show you how to actually tape up a bunion. It really does work. Another thing, soaking your feet almost every day is going to help, and I would recommend Epsom salts. Now, this is not pseudoscience. Epsom salts have high levels of magnesium in it, so it actually works to basically, as a vasodilator, get increased circulatory function in the area, get muscles to relax. It really does work well. These are just some common things that I think are quite effective, and it's essential that you do in addition to treatment and exercise. Just a couple more things I want to mention. One is custom orthotics, getting the right orthotic, not something that's too rigid, but something that's actually suited for your specific gait patterns, not necessarily one you just buy off the shelf. This can help to bring you more into a neutral position, and they will help to actually move you in the direction so that you can reduce the swelling, and in conjunction with treatment and exercise, it really will bring this whole process forward. In most cases I found they don't actually solve the problem. Now, when it comes to exercises, there are specific exercises you can do, and I'm going to give you a link to a video below that we produced and give you the exercises that you need to do on a daily basis. Now, this will require both flexibility, mobility exercises, and strengthening. So you pretty much need to do the mobility exercises several times a day. Strengthening, probably 3-4 days a week. Make sure there's a day in between. But this stuff really works. I've seen patients, the bunion may not go away completely, but it reduces to the point where they're not in pain. They can go on long hikes. I've seen dancers. Dancers notoriously have bunions, especially the ones, the ballet dancers who go on point. And they need viable, functional things that they can actually do to get them out of pain. And there are these things. So I'm going to give links below to the original blog I wrote, but also links to each of the videos. Again, if you have any questions, feel free to contact me. I'm more than happy to answer your questions. So until next time, please subscribe to my channel, and I look forward to your comments.